Let's go to our first guest,
Yeah.
who is on the phone right now, and we will get them on the air here. And good morning, you're on KSJE. Thank you for calling in this morning.
Morning, Scott. This is Bob Underwood over at San Juan Regional Medical Center. How are you this morning?
I'm well, Dr. Underwood. Thank you for calling in. We appreciate it, and we're hoping that you've called in with a little bit of an update for us on how conditions are over at the hospital. What can you tell us?
Yeah, absolutely. As I think everybody knows, across the board, we are seeing an increase, certainly through the state, and we're starting to feel it more here in San Juan County. The information that was put out by the Department of Health yesterday shows us to have one of the highest increases in a per day increase of positive cases, really going all the way back since late June, early July. So that there are certainly more positive cases that we're seeing. Currently at the hospital itself, we have our ICU has 3 intubated patients that are COVID positive. And overall, we've got 22 patients that are COVID positive. That includes those 3. We have 2 patients that we're still waiting for results to come back on. Now, that's not the hospitalizations that we were seeing back when it was, really busy here. Nonetheless, these are increases that we are seeing across the board. So our total hospital census, in other words, all of the patients we have in the hospital right now, is 137 currently in-house.
Thank you. Interesting.
Great. And just a quick follow-up on the ICU thing. How many total beds are in the ICU?
So normally we have a 14-bed ICU. We currently have 8 patients in that ICU. Only 3 of those are actually on ventilators right now. Now, when I say currently, that's because back when we were really full a couple of months ago, we actually converted what we call our PCU, which is kind of a step-down unit between an ICU and a regular floor. We converted that so that it is capable of being a full-on ICU. Currently, that one is full, but those are not COVID patients. There are 9 beds in that PCU area, and all 9 of those have patients in them. Only one of those patients is currently on a ventilator.
Understood. And Dr. Underwood, I suppose then folks there at the hospital, you've always had, I think, these plans to have to expand if you need to, if you see this surge in patients coming in, that you've got room to expand. You just mentioned the secondary kind of ICU area there at the hospital, but this is kind of what the hospital's been working on and been having available almost since this pandemic began. Am I correct?
Oh, absolutely. And you go back to March, April, when this first started, we started making those levels of contingency plans and contingency care models back then. So we started converting floors to be specifically available for COVID patients. We also have areas where we can do telemetry monitoring, that we've expanded that capacity. We've worked on airflow so that we decrease or eliminate the risk of cross-contamination. We've done all kinds of things at the organization. And the benefit is before we even had a patient here that was COVID positive, we had really started working on those contingency models. And now we've had 7 months, 8 months to really work on it and make sure that we're ready for whatever comes next. And the other component of this, if you remember back when we had our really big surge back in April and May timeframe, we were transferring patients out because we didn't have the room to put patients here on some circumstances because we had a big surge. Not as bad as what they were feeling maybe down in the Gallup area, but we certainly were feeling it up here too. We're kind of in a different position right now. In other words, we have capacity And so as other hospitals may reach their fullest, we take transfers in. This has always been the case. We transfer patients in off of the Navajo Nation, extending out in Carinta and other areas. We also take patients in from Shiprock when they don't have room or capacity to care for those patients. And we're still in that. We still transfer patients in when we have space to put them, and we do have space right now.
Great. And I want to switch gears a little bit because the holidays are quickly approaching. And so usually there is a lot of cross gathering, other family members from out of town, etc. We saw Gavin Newsom in California put out some requirements of no longer than 2 hours and no more than 3 different families, etc. So I wanted to ask our local health officials, what are some suggestions for these holidays that are fast approaching, especially since our cases are already on the rise?
Megan, you're dead on that one. Those are going to be concerns, and in a lot of ways, they cannot be completely avoided. I, for one, have a daughter who's in college, and the college shuts down over the holidays, and it's an out-of-state school, and so she will be traveling back here during the holidays. And so, yes, taking appropriate precautions are absolutely necessary. Trying to maintain social distancing. Do not. I think Dr. Fauci said he's going to be celebrating his Thanksgiving via FaceTime and trying to do it in as much of a remote way as possible. And limiting out-of-state travel as much as possible, of course, is very recommended. And even within the state, we in San Juan County are being affected by an increase in the number of COVID cases, but other parts of the states of our state are feeling that more than we are. And so the risk of that cross contamination, to use the term, certainly is a risk. So the things that we have said all along, when you can, wear a mask, wash your hands, and we do recommend quarantining after that level of exposure, but we understand that there's not 100% way to prevent that, as my example kind of showed.
Right. And, some have been saying, well, what if we get tested the week before so that we have the results right before we go? And which brings up another question that has been circulating around testing. One is there's a handful of different ways that these tests work: throat swab, nasopharyngeal, etc. Is there one that seems to be more accurate? And B, what about the stories of false negatives and false positives?
Sure. And so there's one company, it's called Cepheid. Theirs is a PCR, polymerase chain reaction, which really looks at the RNA sequence, getting a little technical here. It is the most sensitive and specific. Sensitivity is, if it's there, how good is it at catching it? Specificity is, if it's positive, how accurate is it that that's really what it's detecting? So sensitivity and specificity are things that we look at. The PCR test is still by far the standard. There are others that look at antibody, which is how your body responds, and it produces antibodies against the infection. We can check for that antibody. It's not as good. And not as accurate. And there's also some question of, okay, what do we do with that information? Just because you have the antibody, does that mean you're actually immune? Most of the understanding of infectious disease and immunology would say that you are, but there's documented cases out there of people getting reinfected, even though we know that they've already been infected once. Not a lot of that out there yet, but research is still being done. Science is really is an accumulation of evidence over time, and time is the thing that we haven't had a heck of a lot of in the grand scheme of things around COVID. There's also antigen testing. Again, not going to be as specific as the PCR testing, which actually, we like to put it in this kind of term, it's kind of like a barcode. If it follows this very specific sequence of RNA nucleotides, then you know that that's actually what it is. So long and short is the PCR test is by far the best kind of test to find out if you are infected. That really shows that the virus is present. The other component of how accurate it is how well did somebody do the swab? In other words, was there an adequate enough sample so that when they run the test, there's enough of the substance there to run the test on? So all of those play into it. Now, the state, New Mexico Department of Health, some time ago was saying that if you got a test within 72 hours of coming back into the state and it was negative, that you could continue on without quarantine. They have removed that caveat. So they no longer consider that necessarily a safety buffer in terms of whether or not you may or may not have or be carrying the COVID infection.
Great. And what a rapidly evolving situation, which is also a race against the clock as more and more people come down with this.
Yeah.
And I, for one, love it when the docs get technical and break it down for us. I'm nerding out over here. But Dr. Underwood, thank you so much for joining us this morning and providing such valuable information.
Anytime, Megan. I appreciate the support that you have given to San Juan Regional Medical Center and to our community as a whole. You know, the more information that we can get out to the public, the better prepared our public is going to be for whatever may come. We don't know exactly what that future looks like. We definitely see a trend going back into the increase in infections. And we're also starting to talk about, okay, when a vaccine is ready, how are we going to distribute it and how are we going to get it out there? And it's really exciting. The last time I talked to you guys, that wasn't even on the horizon, really. We knew it was lingering out there, but we're actually starting to plan the logistics of how that's going to take place. We don't know the timing on it yet. We know it's getting closer, but, you know, like you said, it is rapidly evolving. And professionally, it is a rewarding place to be because I never thought I would see this. Professionally, it's still very concerning because I never thought I'd see this. We talked about the next pandemic when I was in medical school, and that was an untold number of years ago. You know, and here it is.
Here we are. That's right.
Yeah.
Interesting. Well, Dr. Underwood, again, we thank you for your expertise and for sharing it with our audiences today. Thank you so very, very much.
All right. Thank you very much, Scott. Thank